Black swan incidents, like pandemics and other emergencies, require technologically integrated response via cross-functional collaboration, while mining unstructured data by deriving insights from disparate sources. Biowave, through collaboration with Astrikos and Aviva, provides advisory and implementation expertise in the areas of technology, ICT, IoT, consulting, implementation of public enterprise policy, industrial automation and IoT for smart infrastructure and disaster management by means of cognitive intelligence and data science. Our machine learning platform provides predictive and prescriptive analytics along with multidisciplinary collaboration frameworks. The National Healthcare Administrative Platform, NC2RMS from Biowave and Astrikos, is an integrated AI-driven operational intelligence solution that provides the hammer, the holistic mitigation and control strategy to enable collaborative actions and flatten the pandemic curve. The hammer shows how technology-based real-time interventions can quickly control and then dramatically reduce the spread of the pandemic by deploying collaborative platforms. In the current prevailing COVID pandemic scenario, managing and mitigating the spread with the help of technology intervention has become a mandate across the globe. However, through many applications were developed to address some aspects, there is currently no platform to integrate them to enable end-to-end monitoring and effective control. Lapses in supply chain leads to poor distribution, a persistent problem due to lack of visibility of vaccination registration at different centers. Now, the critical necessity to arrest the spread is to ensure that maximum number of people get vaccinated, a process that necessitates cross-functional coordination. NC2RMS is equipped with the required monitoring and tracking mechanism to give the administration an informed, analyzed, actionable perspective to effectively implement the government's vaccination drive. The map-based real-time tracking module of NC2RMS provides the National Healthcare Administration a complete end-to-end view on the number and location of vaccination centers, registration information, number of people vaccinated at each center along with vaccine details, availability, as well as projected requirement of vaccines over a period of time. The mobile application will enable citizens to choose and allow access to the nearest vaccination center, thus enabling them to register for and get vaccinated. Parallelly, the NC2RMS empowers the National Healthcare Administration and other departments like Law and Order to collaboratively monitor and track the spread, enabling stakeholders to make informed decisions to arrest the spread. How do we achieve this? Imagine a situation where in a particular area, town, province is witnessing a surge in number of reported cases. The National Health and Crisis Response Departments, in collaboration with Law and Order and other enforcement agencies, can closely monitor and mobilize required support by creating a red zone and monitoring availability of beds, oxygen, ambulances, ventilators, and other critical medical infrastructure to the healthcare centers. The NC2RMS is equipped with the ability to integrate CCTV cameras which are strategically and optimally located. Video feeds from such cameras can be analyzed using high-end video analytics like IR thermography, face recognition, and etc. to identify and alert the law enforcement agency to take necessary corrective actions by alerting the field response team. NC2RMS has an inbuilt contact center module which enables citizens to reach out to the National Health Administration personnel to get their queries answered and seek assistance with regards to the pandemic, such as accessing to the nearest healthcare centers and medical infrastructure. NC2RMS provides data analytics-driven real-time situation monitoring and assessment to enable stakeholders to act in evolving crises such as pandemics or other disasters and exigencies. In a post-COVID world, NC2RMS empowers cross-functional collaboration driven by AI, augmenting the Unified Operations Center to monitor on real-time GIS maps the trends across areas from descriptive data to predicting the evolving patterns of disease spread in communities, alert the respective departments to drive effective response measures, mobilize emergency response teams, and activate technology-enabled mitigation strategies. Crisis management automation cannot be effective unless all services are operated collaboratively, with analytics-driven actionable alerts, advisories, and automated workflows. All departments must be seamlessly interconnected on the technology platform. NC2RMS, integrated with Aviva UOC, provides unified operational intelligence platform for crisis control and effective response. Aviva is a British multinational information technology company listed on London Stock Exchange with research and development centres across 32 countries, is a global leader in industrial software and process automation. During a crisis, it is imperative to adopt global best practices such as mandated by ISO 22320 to ensure resilience and recovery. Analytics-driven alerts, predictive forecasts, and prescriptive advisories are critical for rapid response to a crisis. All pillars, security and resilience, emergency management, incident response guidelines, SOPs and automated workflows, collaborative intelligence, and analytics-driven forecasts, predictive alerts, and advisories must be seamlessly integrated in this portal. PMO, CPRC, and state chief executives can access real-time updates on advisories and guidelines, incidents and traffic control, law and order, food and civil supplies logistics, medical response team, mobilization and deployment, cluster containment, emergency response management, pandemic assessment, and alerts on emerging threats, coordination with departments such as water supply, power, health, police, local courts, and medical units. NC2RMS provides automated workflows to raise interdepartmental work orders, bring multiple departmental stakeholders on the same SOP execution framework, ensure the SLAs for all the tasks are met in time by all line departments in order to optimize service delivery. Healthcare dashboards provide complete overview of medical infrastructure, emergency services, health providers like doctors and nurses, field workforce mobilization, automated workflows and responses in a collaborative framework. NC2RMS complements sustainable development goals in line with the global standards, improving the overall livability index and quality of life through enabling public administration and citizen services by digital transformation and technology intervention, along with a unique sustainable ROI model. With this globally acclaimed integrated platform of analytics-based collaborative advisories, lives can be saved, sustainability can be achieved. Biowave, human health protection against infections.